You're live.
All right, so this is Senate Health and Welfare. We're back on Friday, April 3rd, and we're continuing a look at budget requests. So we went through the budget with joint fiscal, and now there are folks in the room who have either been underfunded based on what's come over from the House, or were not originally funded or not funded. And we'd like to hear from you because we know that there are a lot of organizations and people in our jurisdiction, and we have concerns. So we want to hear, and then we'll be able to set our priorities. We're not setting our priorities today, but we'll take your testimony. I'm asking each person to be about 2 minutes. That gives us time to listen. You give us the information. We will come back next week at different times for committee discussion, and at some point we'll be able to make our voices heard down the hall in the appropriations committee. So, Jenny Horgan, there you are.
Here I am. Good morning. Thank you so much, Madam Chair. Members of the committee, for the record, my name is Jenny Horgan. I do our state government relations work here in Vermont for the Alzheimer's Association. I'm here to address you all today to discuss caregivers for those living with Alzheimer's and dementia. I have some papers for you all. I know we've discussed in detail before the facts and figures and the impact of Alzheimer's and dementia on the state. That's all included in your packet. But to just highlight quickly, there are 20,000 unpaid caregivers caring for people with Alzheimer's or dementia in the state. That's equating to 29 million hours of care each year at a value of $770 million. And these caregivers are not just helping occasionally, they are providing care 24/7, often bathing, dressing, feeding, managing medication, finances, and constant supervision and transportation for people living with the disease. So it is a relentless job that these people do with very little support. So over 35% of people who are caregivers for those with Alzheimer's and dementia experience depression. More than 61% of them live with chronic health conditions, and more than 10% report poor physical health. Often they are caring for years at a time, and in many cases, they're also caring for their children at home as well. So one of the most effective supports that the state offers is the Dementia Respite Grant. This is a program that allows caregivers to access short-term care through in-home services and adult day programs. So it gives the opportunity for caregivers to attend medical appointments, simply recover, do grocery shopping, and this is a vital lifeline to these caregivers as burnout is very high when caring for someone at this very, very high level. So what we're requesting is an increase in funding to the Dementia Respite Grant program. This fund has not been increased since 2003. And I think we can all agree that the cost for care and everything is significantly higher than it was over 20 years ago. So we're requesting an increase from $250,000, which is the base fund that's currently in the budget, to $750,000. We would also request to raise the cap to $300,000 and look at doing 20% of that being required for out-of-home day respite. We're additionally requesting $100,000 for a pilot program for dementia people program in Rutland and Washington counties. These counties were significantly impacted with the loss of adult day programs post-COVID. And so we are looking at this as an opportunity to create more dementia capable programming in those areas so that people who are looking for respite have something to access to do that. So respite is not only compassionate, it's fiscally responsible, supports caregiver health, delays Medicaid entry, and helps people with dementia remain safely at home rather than entering a more costly and restrictive long-term care facility. I do want to point out on the back of our letter, our coalition letter, there are a number of caregiver stories that give you a very small glimpse and window into the costs and the challenges of caring for someone with the disease. And we hope that these stories really make clear the challenges of caregiving and the needs of this lifeline. So we can answer any questions.
So I do have a question.
Yeah.
The increased number, is there an increased number of those who require care and is there an increased number of folks with Alzheimer's who are requiring the dementia respite care?
We've certainly seen the numbers of Alzheimer's only growing and the need for caregiving only growing. Also seeing the strain on our long-term care systems. It's really just a huge need.
With the adult day and COVID in central Vermont, the need, stress on caregivers. We frequently, those who don't know, I was the outreach director of Independence. We would frequently pick up people when their caregiver ended up in the hospital, frequently from exhaustion. There was frequently men who were trying to do it all alone. Alzheimer's and nothing else, frequently don't sleep at night. And exhaustion, I mean, just not being able to sleep, being afraid they're going to leave out front door, and they do. An adult day would take them during the day. We'd send them home tired, and frequently that would help. But without that, with a caregiver, and I know there were caregivers who once a month would just go away for a day or a weekend, just so be away from. And
Yeah.
it's an essential service. Without it, these people end up in high cost nursing homes.
Senator, you're right. And so what I'm going to suggest is that this is an important comment to make when we get to committee discussion. Make sure you write down what we're going to hear, because we're going to come back to this. Because if we talk about each one as we go along, we'll be here the next week. But I agree with you. Understood. Understood. A quick comment or quick question is fine.
I was really concerned. I think I have my hand up earlier.
You too.
Sorry.
I know, Senator, I feel like
Echoing Senator Cummings, the fact that we have an aging population, we haven't updated since 2003, and it seems like we have cuts towards adult daycare is not a good scenario. So thank you.
Senator Cummings is always right.
Always. Secretary of the Senate says the chair has ultimate power.
Indeed, of the
I'm
Senate.
enjoying
The additional 500,000 general fund, that's just in GF. Do you get any federal dollars at all
I don't believe.
for this
so.
grant? No, so this is strictly.
State dollars, yeah.
Okay, thank you.
Good question. Okay, thank you.
Thank you so much.
All right, so we're going to move on to Callie.
I stopped. I'm just saying, no.
My
My name is Kylie Kuiper.
No, I really believe.
It was very difficult.
And I've heard it before and I remember, so thank you
Hello.
for being here.
Thank you. I'm the state long-term care ombudsman. The long-term care ombudsman program was created in state statute to represent the interests of older Vermonters and Vermonters with disabilities who receive long-term care services. I have a staff of 7 local ombudsmen, and we cover over 6,000 licensed long-term care beds and an additional 4,600 individuals who receive long-term care in the community through the Choices for Care program. I gave you some handouts of our last annual report and some case examples that include how we help people access needed services, like the developmentally disabled man who we helped him get cataract surgery so he could regain his sight. We help alleviate suffering, like the hospice patients who we helped get their prescribed pain medications. And we help keep people housed and receiving necessary services through our work, assisting residents who need help appealing a involuntary discharge. Our work helps avoid hospitalizations and homelessness. And we also help ensure that the large amounts of money the state is putting into long-term care Medicaid actually goes to quality care and not just owner profit. We added an additional position in 2024 to cover Bennington County because we found that we simply didn't have the staff to adequately cover that area of the state. In the year that ombudsman served, she tripled the number of complaints that she was able to work on compared to what we did the year before. And I think that really illustrates how important it is. It's absolutely vital that we have enough ombudsmen to cover the state in person. They need to be in facilities and talking to residents and monitoring conditions there. We haven't had a funding increase in 3 years. We're asking for an increase of $275,000 to cover the Bennington position and significant inflation, especially health insurance increases. That amount qualifies for a federal match. I think it's almost 50-50. And so every dollar that the state puts in, we'll be able to pull down more federal funds. Without the funding increase, I'm gonna have to lay off 1 to 2 ombudsmen. And we simply can't fulfill our state mandate without adequate staffing to have boots on the ground in Vermont. We recently received a lovely thank you note from a client's daughter who said the ombudsman prioritized her voice despite her vascular dementia and aphasia at a critical time when she felt she had no voice. Please keep up the good work on behalf of Vermont elders. So I'm asking you to support our funding increase so we can fulfill our mandate and reach Vermonters across the state of Vermont. Thank you.
Thank you. And thank you for your work.
Absolutely.
And so you are designated through statute and you are within Vermont legal aid.
Correct. And it allows you to be independent.
Yes,
Yeah.
understood. Thank you very much.
Thank you.
So Olivia Shell is here.
Thank you.
No problem. I live in Barry, so it's not a huge drive. For the record, my name is Olivia Sharrow. I'm the Executive Director of Vermont's Free and Referral Clinics. I'm here to ask you to please support our FY27 budget request at the level that was included in the House budget. The amount is $924,000, half of which is from the general fund and half is a federal match of Medicaid dollars. Vermont's Free and Referral Clinics is a statewide association with 8 member clinics. On July 1st, we will become the fiscal sponsor for a community health worker program called Bridges to Health. Funding for Bridges to Health was also included in the House's budget, and I hope that you will support the request as is so that their incredible work can continue. Last year, our members cared for over 9,000 patients. 5 members provide clinical services. All member clinics provide health system navigation support. They help patients access health insurance, free prescriptions, and other benefits and programs. As eligibility becomes increasingly complex, the role of the Benefit Assisters Network is becoming ever more urgent. For this reason, although VFRC's funding is already in the House's budget, we respectfully urge this committee to consider funding the rest of the benefits assisted proposal that you will hear about this morning. Services in our networks are free, always, and by providing an extremely low-cost setting for patients to get the care that they need who don't have insurance or a primary care provider, we divert patients from the emergency room with non-acute needs from the emergency room and save the system millions. We are on the front lines in the midst of converging crises that are impacting all of Vermonters and parties. Between the loss of enhanced subsidies, changes to eligibility, and rising costs everywhere else, we anticipate significantly increased demand for our services. Our request will allow us to operate for more hours and see more patients in the time we have. This will allow us to meet increased clinical demand and support more Vermonters than ever with insurance and benefits navigation. Now more than ever, investing in affordable programs that reduce costs is crucial.
Thank you. And thank you for your work.
Thank you for having me.
Appreciate it.
And another member of our coalition is on Zoom, so I will hand it over to Heidi Sulis, who is also the vice chair of the board of directors of Vermont.
So if Heidi is here and she's going to present additional information or
Yes.
someone, that would be great. Heidi Sulis, why don't you just go right ahead?
Good morning. Good morning. I'm the executive director of the Open Door Clinic in Middlebury, where we provide acute and chronic care, dental care, referrals to specialists when needed, help with health insurance, and a robust outreach program. Last year, migrant workers comprised 53% of our patient population, and we provided health care on 42 farms, orchards, and local businesses throughout Addison County. We do this through less than 6 full-time staff and an amazing cadre of 143 volunteers who support our patients through medical care, interpretation, and administrative work. As safety net organizations, our ability to provide unencumbered grassroots care allows us to serve people who really have nowhere else to go. We are meeting people where they are and directly addressing their barriers to care, including but not limited to transportation, work schedules, language access, and navigating a highly nuanced health insurance marketplace. We are seeing far more chronic illness among our patients and more patients with complex, multifaceted needs that require more of our resources, care coordination, and case management. And once again, we're picking up the pieces, and they're getting bigger by the month. Over the past 3 months, due to eligibility changes at UVMMC's Health Assistance Program, our patients no longer have access to affordable meds. So an incredible burden has fallen to our nurses, who've been spending 1 to 1.5 hours per patient on a single pharmaceutical Med-Assist application. And given the recent destabilization of Bridges to Health, we've hired our own community health worker to address the resulting residual gaps in care. These are just 2 examples of burden and expense that rest disproportionately on the shoulders of our free clinics. An increase in funding would help reduce the significant burden and sustain our increasingly critical programs. We are a stable, safe, respectful, and respected organization within our communities and an integral part of the healthcare delivery system in Vermont. Thank you for considering this.
Thank you. Thanks for being here. Thank you. very
No questions? All right, thank you.
We have Jessica Barnard from VMS, Vermont Medical Society.
Good morning. Thank you for having me. Jessica Barnard with the Vermont Medical Society, and I actually am joined also on Zoom by Catherine Schwartz, the Executive Director of the AHEC program, because a lot of our what we're going to be talking about this morning is related to the AHEC program, that she is really the expert and can help answer questions if they come up. Or I would encourage you, when you're through this really busy budget process, to have AHEC in to talk in more detail about their programs to you. So I'm here on behalf of the Vermont Medical Society, the American Academy of Pediatrics Vermont chapter, and the Academy of Family Physicians. These are actually both about restoring cuts that were proposed in the governor's budget. And one was sort of half restored and one was not restored in the House. So our first request is to restore the DIVA alternative payments to primary care. This is a $2 million cut to primary care of general fund, a $5 million gross cut. So, you did all your work on S197. We're talking about trying to move primary care to alternative payments to stabilize our primary care program. And yet we're facing a $5 million cut from this one loss on top of other cuts, I will say, facing primary care in FY27, a slight reduction in our Medicaid fee schedule, and also the end of alternative payments also through other streams of funding for OneCare's primary care programs. So this was DIVA's way. They were contributing to the OneCare primary care programs. I know we have heard them say their concern is how to kind of operationalize getting this funding out the door. I will say it feels a little bit like Groundhog Day. I was looking back and reminding myself, and in 2019, we faced DIVA proposed cutting an alternative payment to primary care, and the budget had a cut to the AHEC program. So we're back with both of those issues this year. As Maria also are all talking about the need to strengthen primary care. There are mechanisms for distributing payments to primary care through either the blueprint or through DIVA in the past when they proposed that past cut actually was making monthly per member per month case management payments to primary care. So we do know the mechanisms exist. This is an effective and an immediate way to support primary care practices as we're trying to actually build and strengthen our system of primary care in the state. The other piece is restoring the cuts to AHEC's primary care workforce programs. AHEC is a statewide network of academic and community partners working to strengthen the pipeline of primary care and healthcare in our state. There are three sort of buckets that are implicated by this cut. It's a $1.27 million gross cut, both to primary care loan repayment, early pipeline programming, and physician placement. The House did restore a significant portion of the primary care loan repayment. I never want to put words or thoughts in people's mouths. I believe there was some confusion about which amount of funding was needed to restore which bucket. So you'll see that amount of funding is actually closer to what would be needed for the sort of network or early pipeline programming. So there were a lot of line items and concepts floating around, but we are grateful that they at least came close to restoring that bucket of funding.
but then didn't put anything, in the early pipeline programming. And then they did restore the MD placement program. So just to give you a little bit of, snapshot, and again, there's more slides in here than I know I have time for. So some of this is just background, but the need for loan repayment in primary care. We know MDs, APRNs, PAs are graduating with huge amounts of debt, up to $400,000 of debt for medical students, over 50 for graduate nursing students, over 100 for PAs. And we know primary care, we don't have enough primary care. We already know that we're short. The shortage will only grow. And I will mention importantly, we were starting the conversation around RHTP, the Rural Health Transformation Program grants, that it is very explicit that that money cannot be used for loan repayment, and it cannot be used, actually, I should have mentioned on the DEVA part, it can't be used for rates, or supplanting budget funds. So we don't believe there's really a pathway to just saying, oh, let's just, support these programs through RHTP funding. So there's no, as far as we know, no other pathway to fund this really important work. The loan repayments go to all primary care specialties, family medicine, pediatrics, OBGYN, psychiatry, the range of provider types, physicians, nurse practitioners, PAs, nurse midwives, dentists, RNs. It is effective. Over 60% of our recipients continue practicing in Vermont. And a lot of these dollars are actually matched by the employer. So this funding comes in, but then the employers are generally asked to match at least a portion of that to keep that new person working in the practice. So these are just some I'm going to skip through this background. I just want to mention
we're really over your time.
I can stop there. I just want to mention really quickly I don't want to forget the early pipeline programming, working with all through middle school all the way up through medical students to get them into the health sectors. And then a little data I'll leave for you to review on the physician placement program that helps people get into the workforce in practices around the state.
Thank you.
Thank you.
So Senator Julich is our timekeeper.
Okay.
I know this the enforcer, so.
Yeah, I know.
So that's better than being butchered.
That's right.
So, and Catherine Schwartz, we'll hold your testimony at this point, but should we have questions on AHEC, we know exactly where to go, and we appreciate your being here this morning with us.
Thank you.
Okay. All right, so we're going to go to Susie Walker, the Executive Director of Recovery Partners.
Good morning, Senators, and thank you for hearing my testimony today on behalf of Vermont's Peer Recovery Centers. My name is Susie Walker, and I live in Brattleboro. I'm a woman in long-term recovery, and it's my privilege to serve as the Executive Director for the Recovery Partners of Vermont. Recovery Partners represents 14 peer recovery organizations across the state, including recovery centers and recovery residences. Our members provide top caliber recovery supports for people in or seeking recovery, and our PV is the umbrella organization, provides member services including medical benefits management, advocacy, workforce development, EAP services, policy and compliance support, and more. We work closely with our partners at the Department of Health and our provider community. Our membership shares a vision and a strategy for ensuring that Vermont's certified recovery organizations flourish and help community members gain health and purpose. We're tremendously grateful for the funding support the legislature has provided to ensure that our recovery service organizations can provide life-saving services to our friends and neighbors. We're sensitive to how challenging this year's budget is and how difficult the choices are. We appreciate the thought and care our legislators bring to this complicated process. Knowing all of that, we're compelled to request that $800,000 be included in the budget to level fund the recovery centers. That's how important it is to the health of our recovery center system and the Vermonters we serve. This renewal would preserve current services at a time when recovery centers are facing increased demand. People in or seeking recovery benefit from recovery programs that provide access to services and, importantly, connect them with a community of people with lived experience to guide the way to healing and purpose. The loss of this $800,000 in funding would mean having to curtail services and downsize staff, threatening an already vulnerable situation. Recovery organizations have seen a significant increase in demand for our services, and we expect this trend to continue as federal actions make it harder for people who are struggling with substance use to access resources and services. Recovery organizations are also seeing an increase in the number of visitors who are accessing recovery spaces for more general support as other community partners and local agencies downsize or close. In particular, we have seen an increase in the number of people experiencing homelessness who access our space. We do everything we can to support any individual who comes through our doors. As the former director of the Turning Point of Windham County, I know the impact peer recovery support services can have on people and places. People become contributing members of their communities and families, pardon me, and provide compassion and hope for others. One impact we see over and over in the recovery centers is that people who once accessed the centers for recovery support and resource connection become trained recovery peers themselves. Their lived
Oh, Susie, we're way over 2 minutes.
Okay, thank you. Thank you.
We did hear your request.
Okay, thank you.
For level funding, and we do have it here in writing. So thank you. We got it.
Thank you. I appreciate it.
Yeah,
Thank you.
very much appreciate it.
Thank you.
We're going to move on to Rosemary Ross of the Turning Point Center from Central Vermont. Thank you for being here, Rosemary.
Thank you for having me. Good morning. Thank you for the opportunity to hear my testimony. My name is Rosemary Rosa, and I serve as the Executive Director of the Turning Point Center of Central Vermont, a peer-led recovery center serving individuals and families impacted by substance use across our region. I want to acknowledge the reality of this moment. We understand this is a very challenging budget year with difficult decisions and competing priorities. We appreciate the care and thought that goes into every allocation you consider. At the same time, I'm here to respectfully urge you to include $800,000 from the prevention fund to level fund Vermont's recovery centers in the Senate budget, because this investment is not only compassionate, it is essential. It has been interesting listening to this discussion around the prevention fund, and we would be happy to come back and you dive in more deeply on that. What makes recovery centers uniquely effective is our staff. Our programs are led by people like me who are in recovery themselves, individuals who bring lived experience alongside professional training. This combination is powerful because it allows us to connect with people in ways that traditional systems often cannot. When someone walks through our doors feeling vulnerable, ashamed, uncertain, they are met by somebody who has been there, somebody who understands not just clinically, but personally. That connection can be the difference between someone walking back out the door, staying long enough to take the first step toward recovery. Without this $800,000 in level funding, our work is at risk. Recovery centers operate on lean budgets, yet deliver high impact community-based support that reduces reliance on more costly systems such as emergency departments, law enforcement, and inpatient care. Investing in recovery centers is not only the right thing to do, it is also fiscally responsible. We heard the concerns about the lack of funding going to Chittenden County, since Chittenden County can't access the Rural Health Transformation Grant. This $800,000 allocation includes funding for the Chittenden County Recovery Center. The recovery centers statewide collaborate closely, and we all support each other's work. This past year, the recovery centers went through the process of credentialing our staff through the Office of Professional Regulation and certifying our centers through the Department of Health. If we lose funding, a lot of this progress could be set back and lost. And our impact would not be as great. If we lose staff, it takes at least 6 months of full-time work before they're eligible for certification. It would take so long to rebuild if we lose this funding. More lives would no doubt be lost without the support of the recovery centers provide. We are not asking for expansion, we are asking for stability, for the ability to continue showing up every day for the people who are often at their most vulnerable. I urge you to include the $800,000 in the Senate budget to level fund recovery centers. We're not asking for an increase. We're just asking that we don't lose any ground in this life-saving work. This is an investment that affirms that recovery is possible, that lived experience matters, and that every Vermonter deserves access to support, dignity, and hope. It ensures that our communities can be healthier places to live. Thank you for your time, your leadership, and your commitment to the people of Vermont.
Thank you. So your request is consistent with the other recovery residents' request, and what we're hearing is that this is fundamental across the state.
Yes.
Okay, thank you.
Thank you.
So we have Carol Lang Godwin.
Good morning, everyone. For the record, my name is Carol Lang-Godden. I'm the Executive Director at Lamoille Family Center in Morrisville, and I'm the Chair of the Vermont Parent-Child Center. So I'm here on behalf of the PCCs. We respectfully request an increase of $500,000 to the Vermont Parent-Child Center Network's integrated grant appropriation for a total of just over $7.5 million to support Vermont's 15 parent-child centers. This request reflects the very real and rising cost of delivering our 8 core services. We are concerned that this $500,000 request was not included originally in the House budget. PCCs are established in statute, and it is notable that other statutorily recognized providers have received cost of living adjustments in the House budget. If this request is not funded, it will mark the 3rd consecutive year without a COLA for PCCs, an unsustainable situation for a statewide workforce of more than 475 employees. This funding increase would provide approximately $33,000 to each of the 15 parent-child centers and would go a long way towards stabilizing our staffing. Our work is fundamentally relational, human-to-human support, and cannot be done effectively without a stable, well-trained workforce. PCCs are often the trusted support system for caregivers who lack extended family or other supports. We serve as an early safety net, helping families build social connections and support networks. Our staff act as referral specialists, guiding young parents to quality childcare and financial assistance. We are developmental educators supporting families as they navigate difficult news, such as a child's autism diagnosis. We are home visitors delivering diapers and food to families without transportation. We are early childhood experts leading playgroups that foster both child development and parent connections. We are case managers helping families navigate housing instability. Above all, PCCs are community hubs, meeting families where they are and providing immediate support, resources, and reassurance during times of crisis. None of this work is possible without our dedicated and highly trained staff across all of the 15 centers. At my own agency, we recently celebrated an employee's 40th anniversary, an extraordinary example of commitment to Vermont's families. Yet without increases in state funding, offering competitive salaries and benefits remains an ongoing challenge and a growing risk for nonprofit organizations delivering state contracted services. PCCs cannot continue to operate with level funding for a 3rd consecutive year. In FY26, Lamoille Family Center alone will spend nearly $325,000 to provide health insurance for 90% of our staff. This is an increase of $45,000 just from last year. Maintaining this level of support for our employees will not be sustainable without additional funding. We respectfully request a $500,000 increase to the PCC Network's integrated grant appropriation, bringing the total to just over $7.5 million. This investment will allow each center to strengthen staffing capacity, retain the qualified employees that we already have, and continue delivering the 8 core services that Vermont families rely on. Most importantly, it will help ensure we do not have to reduce services due to staff vacancies at a time when families need us most. We also respectfully ask that you support the $180,000 that was allocated in the House budget for concrete supports, which is one of our 8 core services. Thank you again for your time. I know how hard you work, and I know how hard this session
You
is.
just wrapped on time. That was perfect timing. Good.
Great, thank you. PCCs are perfect.
Thank you very much. So we're going to move right along to Jenna O'Farrell of the Northeast Kingdom Community Action Center.
Thank you. Good morning. I'm Jenna O'Farrell. I'm here on behalf of Vermont Community Action Partnership to ask you to invest in proven cost-effective tools that prevent homelessness, stabilize households, and strengthen our communities. Our first request is for $1,250,000 for statewide concrete supports. This funding is not included in the House budget. Distributed across the 5 community action agencies, these flexible client-directed dollars meet acute needs. They pay for emergencies, emergency rent, utilities, clothing, hygiene supplies, replace IDs, transportation, other small but essential items. All 5 community action agencies already use federal funds and local fundraising dollars for concrete supports, but the demand outstrips resources. These modest investments routinely stop a household slide into crisis and help people who are currently unhoused to get basic items they need to connect with services and regain stability. Preventing eviction and homelessness with small, timely payments is far less costly than emergency shelter, hospitalizations, or court proceedings. Please fund our $1,250,000 so our agencies can quickly respond and equitably across the state. Our second request is for $1.5 million for case management and housing navigation support for 3 full-time employees at each community action agency. Case management is client-centered, holistic approach. We assess needs, we create individual plans, advocate, coordinate services so people can secure and sustain housing. Housing navigators work directly on long-term housing goals, removing barriers, securing placements, and intervening when housing is at risk. H938 includes some case management funding, but distribution, eligibility, and sufficiency are unclear. A dedicated statewide increase of 3 full-time employees to community action agencies per community action agency ensures consistent, locally grounded capacity to implement H938's mandates to meet the day-to-day needs of our communities. Investing in these positions reduces recidivism into homelessness and connects people to benefits, healthcare, employment supports, and stabilization services. The third request is for $200,000 to restore the Fair Housing Program through DHCD. This work was previously supported by federal grant that can no longer be performed under the new terms acceptable to our community action agencies. State funding would maintain critical fair housing capacity, reduce homelessness and evictions, investigate and resolve discrimination complaints, educate landlords and tenants, correct systemic barriers, and expand access to the existing housing inventory. This is a prevention and protection that supports long-term housing stability. I urge you to please include these amounts in the final budget. Thank you for your time and consideration.
Thank you very much. Well done. So this very much relates to H938 that we'll be looking at. And I know there's money in the budget, but we'll have to sort out what it is and where it is and how it works. Well, thank you.
Thank you.
All right. And Charlie Glisserman is here from the Vermont Network Against Domestic and Sexual Violence. Thank you.
Thank you. Good morning. My name is Charlie Glisserman, and I'm the Policy Director at the Vermont Network Against Domestic and Sexual Violence, and appreciate the opportunity to speak with the committee about supervised visitation services. The House budget appropriates a one-time increase of $130,000 in general funds for supervised visitation. We're requesting at least a $250,000 general fund appropriation to prevent closures of existing programs and expand access in underserved areas. Supervised visitation provides a safe, structured setting where a parent can have monitored time with their child. Courts and DCF order supervised visitation in situations where safety concerns exist either for a child or a non-abusive parent, and this includes many cases of domestic violence. Trained staff ensure visits occur in a safe, supportive, and trauma-informed environment. Many programs also offer supervised custodial exchange, allowing children to move safely between parents without exposing the non-abusive parent to risk. At their core, supervised visitation services are designed to serve children and help foster safe relationships between them and their parents. These services also play a critical role in protecting the safety of a non-abusive parent. Abuse often escalates after separation, and custody and visitation arrangements often necessitate ongoing contact with an abusive partner, which creates safety risks and disrupts the survivor's healing. Supervised visitation programs have been chronically underfunded for more than 15 years, which has led to multiple program closures and significant gaps in services. Currently, each program receives a small grant from DCF, and some receive supplemental funds from the Vermont Center for Crime Victim Services. Together, these funds range from approximately $16,000 to $40,000 per program annually, which is far below what is needed to sustain services. Last year, we provided testimony to this committee about supervised visitation with similar urgency. When additional funds were not appropriated, one of the state's few programs was forced to close, and other programs are similarly at risk now.
So can you give us the bottom line? Because we're negative.
Perfect. Well, I would say that DCF and the judiciary created a report at the request of the legislature last year detailing the challenges facing programs, and that we would request the committee continue this conversation by having a hearing on the report and appropriating $250,000 in additional general funds to support the programs.
Thank you.
Thank you very much.
I know this is one of those areas that does overlap with judiciary. We'll continue to work with them as well.
Perfect. Thank you very much.
Thank you. Amy Schollenberger here.
Thanks for having me. I'm here to, my name's Amy Schollenberger, and I'm here to ask you to support the request that's been put forth by the Benefit Assisters Coalition. There's a handout and a letter of support under my name and documents. This request is for the Senate to include an additional $3.496 million over the House budget to support this proposal. I want to note that the free clinics are also in this coalition, and their funding is included in the House budget. And ask that is also still included. So this proposal came as a direct result of the changes in HR 1, the big beautiful bill, to SNAP and Medicaid, which would increase requirements on people receiving these benefits to submit more paperwork, to enroll in Medicaid. They'll have to enroll every 6 months as opposed to every 12 months. And in the governor's proposed budget, they have included additional capacity to process that paperwork. This proposal is to help people actually do that, to understand what's required of them, to make sure they are getting their paperwork in, to make sure they're providing accurate information to the state, which will help to keep our SNAP error rate low, which we are all absolutely committed to in the state. So this is to help people for both SNAP, which we call Free Squares Vermont, and Medicaid. There are 2 training programs for benefit assisters to get certified. The Medicaid one is run through DIVA. Hunger Free Vermont runs the SNAP one. And all of these providers have agreed, if the funding is available, to train staff to get them certified, to make sure there are assisters available as these trusted community service provider organizations. The whole point of this is to make sure that we are utilizing our community service network community effectively. We're providing support to the people who need it at places they are already going to get other services, and by talking to people they already trust at those organizations. And we want to make sure that they're getting their federal food and healthcare benefits that they're eligible for, because this money actually supports our state. This is federal funding that flows directly to our grocers and to our healthcare providers through the people who receive these benefits. And it will be a relatively small investment to make sure that federal funding keeps coming.
We're good.
Great.
So when we have your written testimony, I'm sorry to keep doing this, but we have to get everyone in.
Okay.
Next few minutes, but thank you for coming in, and we understand you represent a broader coalition.
Yep, and you have the documents.
We got it. Thank you. So we're going to move on to Melissa Appleton of the Lund Center. Thank you for being here. And so we're in a crunch.
Yeah.
So what we're looking to is what your bottom line request is.
Sure.
That is or is not fully funded in the budget.
Okay, my name is Melissa Appleton. I oversee the post-permanency program at Lund. I'm here to provide testimony. Thank you so much. We wanted to thank you for this time. We wanted to express concern about the post-budget post-permanency services that's currently in the budget, the FY 27. This remains despite the House Human Services Committee recognizing it as a high priority. We're very concerned about the impact for adoptive and guardianship families. We hope your committee can support this and make our levels whole to fiscal year 2026. Lund, along with Easter Seals and NFI Vermont, provide post-permanency services in Vermont. It's a very important service to adoptive and guardianship families. We are working with families with trauma-related behaviors, identity and attachment issues, parenting challenges, issues accessing services. We provided some testimonies from families that gives you a fuller picture of what they're managing and what they need. We exist to support family stability, resiliency, and ultimately preserve that placement. We do not want kids re-entering care, DCF care. We do not want kids needing to access residential care. We do that through parent coaching and support, advocacy, information, and referral. Again, you'll have some materials on that. The proposed cut would mean a 25.5% cut to Lund's funding. that's very big for our families and for our program. We would have to reduce caseloads and limit number of families served. The state is estimating 60 families across the state would not be receiving services through the three agencies. This for families, this would be longer wait lists, less access to support, and shortened duration of support. I also want to know DCF, right now the guidance is saying that we would DCF facilitated adoption would be prioritized. So that's really leaving out guardianship families. So we're often kin, aunts and uncles, grandparents who are stepping up to take care of their kin would not be prioritized for our services. So we're very concerned about that population. We are concerned about this would increase care burnout, placement instability, and heavier reliance on an already taxed mental health system. We're preventative, we're responsive. We're really hoping that you all can support us and going back to those that fiscal year 27 level funding. Thank you.
Thank you.
Thank you.
Chad Simmons from the Homeless Alliance. Thank you for coming back today.
Hi, good morning. My name is Chad Simmons. I'm with the Housing and Homelessness Alliance of Vermont. I'll try to make my remarks very brief. We represent more than 50 organizations and many individuals who are supporting the housing and homelessness continuum across the state. I'm specifically here today to talk about provisions and investments made in H938. We appreciate the work that the House did on the budget, but are concerned that the amount appropriated in the budget and expended through the bill may not be enough to meet the needs of Vermonters experiencing homelessness. And concerned that we won't have enough resources to put forth. So we hope in the coming weeks that conversation will allow us to look at specific areas. In particular, we'd like to see additional resources, at least $3 million added to the case management line item that's currently proposed in the bill, and that will provide statewide resources to provide navigation and case management for folks experiencing homelessness. This is in particular response because we've heard from our members that is one of the greatest needs for folks experiencing homelessness. Another concrete thing that was named in the bill but was not funded in its current construct is a proposed merger of the two continuums of care across the state. We are open to exploring what that would look like. The state cannot mandate the merger, but we would ask for resources, including up to $50,000 to help with the conversations and reporting necessary, especially working with our federal partners in HUD and trying to maximize how much federal dollars that the state can bring in. Not just in the first year, but over multiple years. And finally, we support the SASH program, and it is not currently considered in the FY27 budget because it's exploring other funding opportunities, but asking that this committee include a letter of support encouraging AHS leadership to find the additional funding outside of the FY27 budget that will provide a $5.1 million gap in calendar year 28. Thank you so much.
Thank you. And we'll be taking up H938 separately, so we'll probably hear you again.
Yes, I hope so.
Okay, Christina McLaughlin from Health First. Thanks for being here.
Hello, good morning. Thank you for having me. So my name is Christina McLaughlin. I'm here on behalf of Vermont Health First, which is an independent physician association representing healthcare practitioners working at clinician-owned practices throughout the state of Vermont. We currently have about 66 primary specialty care practices across 11 counties in Vermont. This includes 127 primary care clinicians caring for about 90,000 patients in Vermont. We have 108 specialists offering over 25 specialty care services. So you heard from VMS earlier today about the numerous cuts or lack of funding to primary care in the FY27 budget. So I won't get into all of those, but I'm here to specifically ask that your committee consider reallocating the $2 million appropriated in the House passed budget for the Provider Stabilization Fund to instead use that $2 million to restore the $2 million cut that the Department of Vermont Health Access cut in base funding, which would draw down $5 million in gross. This cut eliminates a $4.75 PMPM payment to primary care practices, which has been very critical to our practices in Vermont. As I mentioned, there have been numerous cuts to primary care, and so we're trying to come to you with a proposal to say this may be a nice way to truly provide stabilization to providers, particularly primary care, draw down more funds while acknowledging there are further cuts happening, and this would really go a long way given those further cuts. So we really support this proposal. We hope they can truly consider it, and we appreciate you hearing from us and you for your consideration.
Thank you. And we don't have it in writing. I think there are a number of folks who didn't send it in.
I will send it.
We'll get that.
Yes, I hear that.
Okay, that's great. Thank you. So we'll move right along to Carrie Stoller. We have two more folks. We have Carrie Stoller and Christina Kennedy. So we want to hear both. So Carrie, go right ahead.
Great. Thank you so much, Chair Lyons. Thank you, committee, for your time today. My name is Carrie Stoller. I'm the Government Affairs Officer for Vermont Food Bank. And when the state of Vermont steps into leadership for food security, all of our collective action will be successful. Vermont Food Bank is seeking a total of $5 million in state FY27 to support the roughly 70,000 people our network feeds each month. This is detailed in 3 different areas. I'm going to give you the treetops. You should have our full written proposal. I'm also going to let you know what happened in FY26 and what is currently in the House version of the budget. The first portion of our request is $2 million to fully fund the Vermonters Feeding Vermonters grant program through the Agency of Ag, Food and Markets. This program grants funds to purchase Vermont grown and raised food that Vermont Food Bank distributes through food shelves, meal sites, and direct distribution programs that serve people in all 14 counties. In FY26, $885,000 was appropriated to this program. In the FY27 House budget, there is $400,000 for this work. We ask that you retain the $400,000 in the House version of the budget in your Senate budget. Part 2 is $2 million to fund food shelf and meal site network partner services. This supports our local partners, about 220 of them across the state. This helps to keep shelves fully stocked and make sure there is enough food for the neighbors visiting those sites each week. In FY26, this was funded at $1 million, and that funding came through DCF. It is currently funded at $0 in the FY27 House budget. We ask if any additional one-time money becomes available, that some is allocated to this portion of our request. The third section is $1 million to fund a ready response program to ensure that food and water is available in disasters and other emergencies. Through this program, we're seeking to formalize a relationship with Vermont Emergency Management to assure that Vermont Food Bank and our network are prepared and resourced to address acute short-term needs for food and water in emergencies or disasters. The language creating this grant program is traveling with Bill H935, which allocates $500,000 in one-time funding to this program. We would simply ask that this committee supports retaining that level of funding in the Senate version of the budget. We also would like to ask that you support the benefit assisters request that you have heard about earlier. We view this as critical strategy to relieve pressure on the charitable food system by helping more people access federal benefit programs, including SNAP, which provides money to buy groceries. Funding at the requested level of $3.496 million will directly help meet people's basic needs and hopefully alleviate some need for people to use food shelves and direct distribution events. Thank you for your consideration at this time, and I'm happy to answer any questions.
Thank you, Carrie. Got it. And make sure we have everything on our webpage.
Great.
And Christina Kennedy, you're here.
Good morning. My name is Christina Kennedy, intern at Jackson Renfrew, and I'm here to present the testimony of the Vermont Aging Network Consortium. VANC is a formal affiliation of the five designated area agencies of aging. we request the following budget items. So VA&C requests a total appropriation of $2 million in base funds for home delivered meals for older Vermonters. The House only appropriated $500,000 in general funds. And we have requested in the House a 3.5% inflationary increase in Medicaid reimbursement rate, which includes AAA case management services. The House only appropriated what amounts to approximately 1% increase. We joined with the Alzheimer's Association and the Vermont Association of Adult Day Services in requesting support for the asks in S242, an increase in the Dementia Respite Grant program by $500,000 as well, as a $100,000 request to support services in underserved areas. This grant is administered by the area agency on aging to serve unpaid caregivers of loved ones with dementia. Thank you very much.
That was quick.
Such a short night.
Short.
I know you're out of time.
So I am hearing that you have some consistent recommendations consistent with what the Alzheimer's folks are also. Okay, thank you. Okay. Well, that was good. We did it within our time allotted. I appreciate you. No, she's on the list. That was written test. We're good. I think we're ready. Committee, my suggestion is think about the budget presentation that you had today from Nolan and Amy. Look at the information we had on the substance misuse and recovery data, and then think about these requests and how they fit with our priorities, your priorities. We will come back to these for discussion, because I know there's a lot to be said about each one of these. So we are calling it a wrap for the week.